Hello and welcome. Today, we're diving into a common yet serious healthcare concern: urethral catheter-associated urinary tract infections, or CUIs. We'll explore what causes these infections, how they affect the body, and importantly, how we can prevent them. So, what leads to a CUI? The primary cause is, unsurprisingly, the insertion of a urinary catheter. While necessary in certain medical situations, a catheter provides a direct pathway for bacteria to enter the bladder. These bacteria can originate from various sources: the patient's own skin, healthcare providers' hands, or even contaminated equipment. Factors like improper insertion technique, prolonged catheterization, and inadequate hygiene significantly increase the risk. Now let's understand how CUIs develop. When a catheter is inserted, it disrupts the natural defenses of the urethra and bladder. Bacteria, often from the perineal area or the catheter surface itself, ascend along the catheter into the bladder. These bacteria then colonize the urinary tract, multiplying and forming biofilms on the catheter. These biofilms protect the bacteria from antibiotics and host defenses, making eradication difficult. The body's inflammatory response to this bacterial invasion leads to the symptoms we associate with UTIs. CUIs are a significant problem, particularly in hospitals and long-term care facilities. They are one of the most common healthcare-associated infections, accounting for a large percentage of hospital-acquired infections. The risk increases with the duration of catheterization. Patients who are elderly, female, have underlying medical conditions, or are immunocompromised are at higher risk of developing CUIs. The signs and symptoms of a CUI can vary. Some individuals may experience no symptoms at all, known as asymptomatic bacteriuria. However, others might present with classic UTI symptoms such as fever, chills, lower abdominal pain, flank pain, urgency, frequency, and dysuria, or painful urination. It's crucial to note that in catheterized patients, systemic symptoms like fever or altered mental status may be the primary indicators, as local urinary symptoms can be masked. Diagnosing a CUI involves a combination of clinical assessment and laboratory testing. A urine sample is collected, ideally after removing the catheter or replacing it with a new one. The urine is then sent for analysis, including a urinalysis and urine culture. The urinalysis can detect signs of infection like white blood cells and bacteria. The urine culture identifies the specific bacteria causing the infection and determines its antibiotic susceptibility, guiding treatment decisions. While CUIs aren't typically classified into distinct types like some other infections, it's important to differentiate between asymptomatic bacteriuria and symptomatic infection. Asymptomatic bacteriuria, the presence of bacteria in the urine without symptoms, is often left untreated in catheterized patients unless they are undergoing urologic procedures. Symptomatic CUIs, on the other hand, require prompt treatment. Treatment for CUIs typically involves antibiotic therapy. The choice of antibiotic is guided by the urine culture results and the local antibiotic resistance patterns. It's crucial to use antibiotics judiciously to prevent the development of antibiotic-resistant bacteria. In addition to antibiotics, supportive care such as adequate hydration and pain management may be necessary. Removing the catheter, if possible, is also a key component of treatment. Prevention is paramount in reducing the incidence of CUIs. This involves strict adherence to infection control practices. Key preventive measures include avoiding unnecessary catheterization, using proper insertion techniques with sterile equipment, securing the catheter to prevent movement and trauma, maintaining a closed drainage system, ensuring proper hand hygiene before and after catheter manipulation, and regularly assessing the need for continued catheterization. Catheter alternatives like intermittent catheterization should be considered whenever possible. The prognosis for CUIs is generally good with prompt and appropriate treatment. However, CUIs can lead to serious complications, including bacteremia, sepsis, and even death, especially in vulnerable patients. Recent research is focused on developing new catheter materials that resist bacterial colonization, as well as novel strategies to prevent biofilm formation. Antimicrobial-coated catheters and antibiotic lock therapy are also areas of ongoing investigation. Continuous innovation in prevention and treatment strategies is crucial to combat the ongoing challenge of CUIs.